The risk of hospital admission during the country's fourth wave, when Omicron spread rapidly, was 29% lower than during its first wave in early 2020. And patients infected between mid-November and early December were also less likely to end up in intensive care units, experts said. They estimated that 2 doses of the Pfizer vaccine were still offering 70% protection against hospitalization, despite a rise in breakthrough infections. The research is by private health insurance administrator Discovery Health, with South Africa's Medical Research Council, SAMRC. However, Professor Chris Whitty told cabinet ministers yesterday that a significant increase in hospitalizations from Omicron was expected in Britain. The Prime Minister's spokesman reported that the Chief Medical Officer said it was too early to say whether cases were reducing or plateauing in South Africa, but there was no reliable evidence from South African scientists of a peak in case rates, and added that it also remained too early to say how severe the Omicron variant was. South African scientists were the first to raise the alarm over Omicron in November, as the country saw a rapid surge in infections. Discovery Health CEO Dr. Ryan Noach said, "Epidemiological tracking shows a steep trajectory of new infections, indicating a rapid spread of Omicron, but so far with a flatter hospital admission trajectory possibly indicating lower severity." Dr. Noach cautioned that all the data was preliminary and factors including high levels of previous infection in South Africa may have skewed the results. See the latest COVID vaccine stats below and visit in your area for all the COVID vaccine latest. Children seem to be a fifth more likely to be hospitalized with Omicron, while risk of reinfection with the latest variant was much higher than for previous strains, causing more breakthrough infections among the vaccinated. For 2 doses of the Pfizer/BioNTech vaccine, protection against infection plummeted from 80% with Delta to just 33% with Omicron. But the jabs were estimated to have offered 70% protection against hospitalization as Omicron cases rose. This compared with 93% against Delta. SAMRC President Professor Glenda Gray said, "It is extremely important to be able to demonstrate to the public that in a real-world setting, in the presence of a highly transmissible new COVID-19 variant, the Pfizer-BioNTech vaccine gives good protection against severe disease and hospitalization." Addressing UK MPs, Dr. Angelique Coetzee, chairwoman of the South African Medical Association, said the findings lined up with what she had seen, saying many cases were mild and symptoms in vaccinated people were less severe or intense than in the unvaccinated. But Dr. Simon Clark, of the University of Reading, argued that Omicron is still dangerous, adding that its high transmissibility could deliver a much more significant impact to society and the NHS than previous waves. See the latest COVID vaccine stats below and visit in your area for all the COVID vaccine latest.